everybody, welcome to week 7 in the assessment course. We are almost there. You can see the light at the end of the tunnel. All right, this week our DQs are about risk assessment and getting consults in hospitals. The risk assessment question is interesting because it's not in the healthcare setting, it's in the private sector. And sometimes we do need to be a little bit careful about giving out nursing advice versus giving out medical advice. So I'm looking forward to reading your answers to that. And then as far as getting consults in hospitals, sometimes this can be really frustrating. You go through that whole nursing admission process and you realize your patient from the indicators needs this, 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 and this, but the doc doesn't really understand the full implications. So I have a few ideas on this of how I've handled those situations before. But I'd like to hear your thoughts, so I'm looking forward to that. And then in our lecture, we talk about interdisciplinary teams and quality and safety. And I really enjoy working on interdisciplinary teams because I think viewing things from multiple angles only helps us in solving patient care and patient process issues. So that's definitely a plus. But sometimes different disciplines have different perceptions of each other, what they've studied, what their role should be in that setting. And so I'm going to include just a real brief article about a nurse and interdisciplinary perceptions. And I'll be interested to see what you think about that. And depending on how long you've been a nurse, sometimes your perceptions change. Back when I started nursing, there were physical therapists and respiratory therapists, but a lot of times nursing did a lot of that. I remember giving my own inhalation therapy, making changes to the vent settings, did almost all the walking with my patients, different things like that. And now we have all these people that have different pieces of the patient care, and sometimes it can be wonderful working together as a team, and other times it can almost seem like we're tripping each other over each other's toes and maybe trying to define who should really do what. And so I'm looking forward to some good discussion about that this week. So you guys have turned in spiritual assessment, so I'm really looking forward to reading those. In many of my classes this week, I have a lot of students turning in papers. So I will get them back to you within 7 days, but it might just be at that mark, kind of depending on which class I get to first. There's just a lot this week, but I can't wait to look at those and see what you thought. And then no assignment this week, good for you. And but week 8, we've got that CLC assignment looking up. Based on risk assessment, and I think I've seen some posts in your forum kind of already working on those and getting some assessments on patients. I think you guys divided those up, so great for being proactive and working on that ahead of time. All right, I think that is about it for this week. Just a nice short sweet video, and I will attach that article for you to look at, and hopefully we can get some discussion going on that. All right, guys, see you in the main forum.